Welcome to the Tell Me It Will Be Okay podcast, the podcast for parents raising anxious kids in a worried world. This is Dawn Friedman. I am a therapist and parent educator specializing in supporting parents of anxious kids. And for this episode of the podcast, I wanted to welcome Dr. Melissa Giglio. Melissa is the director of the Central Health Partners Child Development Team in Hong Kong, although she does come over to the States in the summer to run summer camps for children with selective mutism. She is a cognitive behavioral therapist, and she specializes in the treatment of childhood disorders, specifically selective mutism, as well as other anxiety disorders, oppositional defiant disorder, and ADHD and autism. She created the Confident Crew, which is an intensive group behavior therapy program for kids diagnosed with selective mutism and social anxiety, and she runs the only evidence-based intensive treatment program available in Asia that's recognized by the Selective Mutism Association. I invited her to be on the podcast because this is a topic that is near and dear to my heart. There was a child in my life raising my kids, one of my kids' best friends who had selective mutism, and watching that child's experience, watching their parents struggle to get appropriate support, watching that child overcome selective mutism was inspiring for me. And I knew that more people needed to be aware of what selective mutism is, how to know whether or not your child is struggling in this way, and how to get help. So let's just dive right into it. We are here to talk about selective mutism, and I know a lot of people have no idea what that is. So can you just give a rundown of what selective mutism is?
Selective mutism is an anxiety disorder that is characterized by a child who, in specific situations where they're expected to speak, they're unable to. And it has nothing to do with the communication disorder. They actually at home are able to speak clearly, fluently, confidently. They tend to be very assertive at home. And then they get in these different situations. And because of their level of anxiety, they are unable to verbally communicate, sometimes even participate in school activities, sometimes even limiting them speaking to close family, friends. It really impairs their overall functioning. And it's never diagnosed within the first month of school. So it's something that's persistent.
So it used to be called elective mutism, and then they changed the name. Can you explain why they changed the name?
They changed the name a long time ago because elective suggests that they're electing not to speak. And there's actually been some discussion about even saying selective mutism. And it really depends on your lens of it. How I view selective mutism means they are unable to speak in selective environments, as opposed to they're selecting not to speak. Some of the people who kind of are interested in changing it is they want to call it situational mutism. I think it's kind of the same, but it's just where there's this stark contrast between who they are when they're feeling very comfortable and how they feel in other environments. And that's really the difference there. It's their body's coping mechanism. And that's kind of how it emerges, is they're in the situation and they're unable to verbalize.
So people might think they're just being stubborn or difficult.
They might think they're stubborn, difficult. These are all misconceptions about it. This isn't a choice. They're not digging their heels in. And sometimes this can be the lens with which they're viewed when others hear that they are able to speak and communicate fluently, and they're not doing it. So they're not greeting people. They're not engaging. They're not responding if someone asks them a question. If they look at it through that lens of oppositionality, it seems like they're trying to be difficult because they know that they can, as opposed to they're feeling overwhelmed and anxious and they're unable to at that moment.
How would a parent know if their child is just being difficult or they really are unable?
I think it's the big difference in their personality in these different situations. So oftentimes parents don't realize that their child isn't speaking all day long in school until about that November parent-teacher conference. And really depending where you are. So in the States, kids start pre-K at 5, kindergarten 6. That is often when parents first hear about it. They will see them as being more reticent to speak, having difficulty speaking to people, but they don't really see it as something that's impairing their functioning until they're in a setting all day where they're expected to speak. Here at Hong Kong, our kids go to preschool unaccompanied, at 3. So we tend to get kids a bit earlier here because they're already in that setting 5 days a week. And when they hear about it in November or let's say March of the year, and they hear, does your child speak? That's the first time parents really are like, they haven't said anything all year. So it sometimes feels shocking to them that they're more than just shy.
Yeah, so that's interesting. Let's talk about shy. What's the difference between shy and social anxiety?
So shy is when you first enter a situation, it takes you a little while to warm up. But then once you warm up, you are just like your normal self. So you might not want to have the spotlight on you suddenly or be the center of attention, but you're yourself, you're comfortable. You just have to kind of get over that initial hump. And when you have social anxiety, going into social situations feels hard. It feels something like you want to avoid or you're feeling overwhelmed by. So with little kids, you'll see them kind of have this stock still behavior where they have this flat affect. So they don't also look like they're anxious because they're not crying or shaking. They just look kind of flat and they get kind of rigid almost. And sometimes they're unable to move unless they're kind of helped to the next, to their table to sit down. They're just so flooded and it stays like that most of the day. Like they might be able to do some things non-verbally, complete some tasks, but they're not verbally engaging, not responding. Sometimes they have trouble even getting started on tasks. Some of them, even as young as 3, realize if I don't drink water, I won't have to use the bathroom. So some of them are avoiding liquids and food in certain situations because they don't want people to watch them eat. And there's quite often an overlap between selective mutism and social anxiety disorders. Even though they're 2 distinctive disorders, there quite often can be comorbidity with both. I think persistent is one of the biggest keys, is that this is a persistent inability to speak over time.
When you say persistent, what does persistent mean? So is it, if I've got a child who struggles to join in at birthday parties, but eventually joins in or cries when I drop them off at preschool, how do I know when it crosses over from typical to something to be concerned about?
I think when it takes a long time, it's taking longer than normal. So for us, when we have kids who do start to mouth some utterances in April of the school year, that is persistent. That is, you've already missed the entire year before you're able to get even close to starting to make a slight improvement. That is taking way longer than it should for you to address, which means you've been in distress and anxious this entire time. And that's when it's more than it should be. Kids being nervous before going to a new class or activity or joining a new sport because they're not sure how they're going to do and being hesitant, that isn't the same. That's the healthy amount of anxiety where you're kind of not so sure, you're trying to find the bravery, but when it's consistent and persistent, it's carrying over. And every time they have to go there, it feels too hard. So when it's constantly a struggle, and they're feeling overwhelmed. And even when a parent's starting to say, oh, they don't like it after 3 classes, they're not participating at all, that might mean they're feeling too hard. And, we always tell parents with all these activities, if you sign up for a semester, you need to give them the chance to participate, which means they might need longer. Like they might need a semester of not participating. But if they're going and they're watching and they're there, you still have this opportunity where they could one day be like, okay, I got it now. I know the routine. I know it's going to go. And now I'm going to give it a go. But they're letting you know they're not ready yet.
Yeah, let's talk about the difference between slow to warm kids, need time to warm up, and kids that there's never going to be enough time. They're needing some extra support.
I think when you're seeing them miss out on things and they're either upset afterwards or they're angry they weren't able to do something or they're not going in and playing, I think that's when you know that this is to a level that's concerning. And as a parent, it's really hard for you to see that. But socialization is so important to kids, building those relationships, getting that practice. And we want our kids to enjoy activities and birthday parties and going to new places and just being a kid. And when your anxiety is blocking you from that, that's too much.
What do parents need to do if they think their child is struggling this way? That might be social anxiety, might even be selective mutism. Maybe you don't have the opportunity to observe your child, so you're not sure.
Yeah. I think collaborating with the school is a big deal, so you can get that feedback so you understand exactly how they're functioning. But when our kids are little, we often are going to those activities with them. We're watching from the side. You can see what's happening. The biggest thing is to not rescue and take them out of it, but to say, we're going to stay here and we're going to watch, and I'm here for you. And when you're ready, you're going to go in. So it's giving that support, but also the expectation that you feel that they can do it. And I think that's one of the biggest things, is this faith that they can do it. And the key with anxious kids too is to not be upset by their inability. Like, they feed off of the energy that you're giving them. And if you're feeling stressed because they're not doing it and you're getting angry, that's not going to help them go in and participate. It's you saying, you're just not ready yet. That's all right, bud. I'm going to be here with you. I know you can do it when you're ready. And just having them stay there and habituate to the environment. So that way they can want to do it eventually. And if it's because they feel like there's an inability, that's when we start thinking about, okay, how can I help them feel more successful at this? Does this mean I'm kicking a ball with them in the yard outside, or teaching them how to play catch, and building that confidence and front loading? So that way, when they get there, they're like, oh, I've already done this. I do know how to do this. These kids are hyper aware of how they're doing compared to others, or what they see someone doing something that looks so much better, even if it's not, because they want to do well. We see a lot of perfectionistic tendencies in these kids. And that can also be what's really getting in the way with their ability just to give it a go. And I think the thinking is just go for it. And if they could, they would. It feels like it's too much. And we just want to make sure we're not pressuring them, but that we are giving them that confidence. We're letting them know we believe in them because they look to us. But we're also saying, we're still going to stay here. Like, it might feel uncomfortable, but you're safe and I'm here with you, and we're still going to stay. So there isn't this avoid.
So what about the kids who melt down when you expose them to something new?
I think you still try to stay in the environment, calm them down, get them regulated, because they're not able to rationalize when they're dysregulated. All you have to do is stay here. You don't have to participate if you're not ready yet. Take that pressure off. Just let them know that the plan is to stay. That's it. If that's the goal for the day. I've had kids who've gone an entire semester and never left the bench, but they were watching and they were there. And then over time, they eventually go in and play. And again, it might not be their forever sport. It's not about our kids being good at things. It's just about having this open mind to trying new things. And that's really what we want our kids to have, is this, I can try. It doesn't matter how it turns out, but I gave it a go. I really did have an open mind and try it out.
Yeah, I think parents sometimes think exposure means the whole thing. Can just be, I drove there in the car and maybe I couldn't get out of the car, but we sat in the car. So we watched the game from the parking lot. Yeah.
And I think every time we try to get closer, but I think it's really having this sense that you're telling your kid, I know you can do this. I know that, hopefully they've been interested in it, and you're just not ready yet. And we're going to get there. And that kind of we're in this together attitude. So they don't feel upset with themselves, but they also don't think that they're disappointing you. It can just add more stress to them.
We know that anxiety can run in families. We inherit our brains from our parents. We catch our kids' anxiety. They catch our anxiety. What does that do?
So a lot of times that happens. And when we discuss with parents, we're going over the skills and really educating them on these disorders. We talk about the apple in the tree and how high the rate is of heritability in terms of having one or both parents with some level of anxiety, even if it's subclinical, right? It's not that clinical diagnosis. But the important thing is to check in with yourself as a parent, saying, do I think they can do this? Is this above their capability, or is this and that just right? And are they safe? And if you can say those things, then you can say, okay, then it's my job to help them increase their distress tolerance, that they can do new things, that they can leave the house, that they can try something new. And all I want is exposure to these things. Again, participation, that's the gravy at first. And it's really just getting there and not running away because it feels too unknown and too hard. And kids need different amount of time to get to that comfortable spot. And that's okay. Like, I think that's the individual difference piece. But if you are an anxious parent, it's asking yourself those questions so that you can feel good about, okay, I know this is appropriate for them. I know it's safe, and I know they're going to feel great when they're able to do it. So I'm just going to keep gently encouraging and letting them know I'm here to support them, but this is what we're doing.
And that's our exposure. Like the discomfort of my kid maybe is embarrassing me, or I'm worried my kid is never going to be able to do it. But the question I get so often from people is, how do I know I'm not harming my child? How do I know that this exposure is not traumatizing them?
So they're not traumatized unless you're pushing them too hard, too fast. Just being there isn't traumatic. And that's why you do that check-in with yourself. Is this safe? Are they in harm's way? Is this, too scary for them? Like, are they, doing a zip line? Like, those are things that are scary. Mm-hmm. This is something that's, if we go from 0 to 10, the most dangerous, this is like 2s and 3s. And there's a lot of other kids having a good time. And will the win of them finally running around and playing and joining in be well worth the journey to get them there? And I think that's the check-in you have to do, is that, this is appropriate for them, and the upside of it will be so much greater than how hard it is to get them there. And with every new thing that they do, that they are able to finally get in there, just say, it's going to make it easier for the next new thing they have to do. And it just keeps growing from there.
In the States, I don't know what's happening there. I think you're clued in internationally, so you probably actually have more perspective about this than I do. But there's a lot of talk about pathological demand avoidance, pervasive demand avoidance. And some of the messaging around that is just give up. Like, instead of working with that demand avoidance, it's, hey, this child, just give up. Otherwise, you are creating problems for them. So can you speak to that? Because I think there's a nuance there that we need to dig into.
I definitely agree. I think PDA has come up quite a lot. And I think part of that is the kids having a really hard time, and they just generally are saying no to pretty much everything. And then you think about it, their world can get really small. And that's what we don't want our kids to have. So with PDA, it's really about giving some perceived control. It's about giving them some choices, but still having them do stuff, because that is how the world works. You have to get out there and do things. You have to get comfortable being uncomfortable. And that means you got to be in the situation, and maybe you have to do your math homework, even if it feels hard and you're not quite sure. And a lot of what we do is help them say what it is that feels difficult. I don't quite understand. It's hard for me to concentrate on this. I would rather be playing video games. These are all true. Mm-hmm. But that doesn't mean these are things we have to learn. And the best learning comes from when we're struggling. And it's really understanding the function of that demand avoidance. They don't feel coordinated enough to participate in some of these activities. Possibly. Maybe they are struggling with that coordination, and we have to think of what would be a better step. Is it working with an OT who can help them, number one, regulate their system, but two, help them strengthen their balance so that they feel more capable of being able to try those things and being successful?
I think when a parent is concerned about PDA or demand avoidance, it is really important to get an understanding clinical eye on that, whether that's an OT or a therapist of some kind, a psychotherapist of some kind, because we're talking about building skills and distress tolerance, and that can happen in a variety of different places. And sometimes having a third party's eyes on it to help you figure out, okay, listen, soccer is not where it's at. It's actually breakfast. You guys need some help around breakfast, or wherever it is. The family, one, needs some wins. And two, where the child is most likely to experience themselves as someone who can do hard things.
Exactly.
And sometimes having a third party's eyes on it to help you figure out, okay, listen, soccer is not where it's at. It's actually breakfast. You guys need some help around breakfast, or wherever it is. The family, one, needs some wins. And two, where the child is most likely to experience themselves as someone who can do hard things.
Exactly. I completely agree. When you're in it, it's really hard. But if it's feeling too hard as a parent, it's great to have that third party as a resource. It's great to check in and say, what do you think about this? Is there a different way that I can look at this or approach this so that it doesn't feel so hard all the time? Because it gets very tiring for a parent who has a kid who's constantly fighting them all the time on things, and they're not sure if they're doing the right thing. And caregivers, all we want to do is love our kids and help them be successful, happy, balanced. There's a lot of bumps in the road when you're doing that, though. Like it's not always easy, and different kids need different levels of different things. And so we just have to kind of look at why it feels so hard and then how to help them be flexible.
So I'm curious, back to selective mutism, is there comorbidity with other diagnoses and selective mutism?
Yes, there's a lot actually. So a lot of anxiety disorders can be comorbid with it. I'd say one of the biggest disorders that kind of pops up after we've successfully treated it is ADHD, which is just fascinating to me because these kids are so anxious all day long. You would not suspect they had ADHD until we kind of remove the anxiety. And all of a sudden we see that they're moving all around, they're hyperactive, and they're trouble sitting still. And just to think how high their anxiety has been to mask that for a year, 2 years, it still blows my mind because it's just that significant. It is totally changing the way they are behaving when they're comfortable and just feeling like themselves. Everything is suppressed.
I shared when we first got on here that there was a child in our life when my kids were growing up who had selective mutism. And that's exactly what happened with them. They were almost classic that they didn't get diagnosed until they went to kindergarten. And then once that was sort of managed, they ended up also with an ADHD diagnosis. And meds were part of that child's treatment. Is that typical?
I would not say typical for everybody. I think it depends on the severity of the presentation. And also, at what point are they responding to treatment? Are they doing the evidence-based treatment for it? And are they responding to that? If they're not responding to that, that might be an indicator. If they haven't had evidence-based treatment and they're a little older, that might be a possibility. But, it's never the first go-to. We really try to see how it goes, doing what we know how to do and supporting the family. I think that's a massive piece, is training the parents in the skills, doing the work during the week too. So it's not just once a week coming to the therapist or just coming to an intensive camp for 1 week. It's an ongoing process. But if they're not making progress and it feels too hard for them for too long, that's when we say, okay, this feels bigger than that. They're so anxious that they're not responding to the treatment because the level of anxiety is way too high. And our goal is to not have them on meds forever. Our goal is to have them on meds for, if possible, a year's worth of life events, a year's worth of birthdays, Christmas holidays, maybe a vacation, start of school. So at a therapeutic dose, they feel successful and they've practiced so many times doing so many things that when we titrate off, even if they feel a little bit of anxiety in their body, they'll have already done things so many times, like, but I can do this. And they can tolerate the anxiety more because they've overlearned how to approach and how to participate and do all those things.
So selective mutism, you mentioned earlier about fading in the therapist. And because I think I think a lot of therapists do not have the training that we need. And we take on working with these kids and we think we're just going to talk them into it. And so we just spend all this time trying to talk them into it. But selective mutism there is a strong research base that should inform treatment. So can you talk about what's different about the treatment and how to find someone who knows what they're doing?
Yeah, so you can find clinicians who know what they're doing, especially in the United States, but also globally through Selective Mutism Association. It's a great resource where there's professionals from all over the world, and they kind of are doing pretty much the same thing, I would say. So our thinking around it has really been based when they're really little. It's definitely more behavioral. When they're older, we start incorporating some more CBT in there. But what's really changed, I'd say, over the past 15 years is the parent component. And it's about bringing them in from the beginning, exposing them to the skills, coaching them in the skills to help them really have this fluency in them, and then working with them to help do the work not only in the clinic, but in the community, at home, and thinking big picture of all the things we need to do. So it's very systemic that way. And then for a lot of cases, we do have to move into the school for a bit to kind of pass the baton to the teachers, with the goal being we want to generalize speaking to everybody. It's a kind of a long process. I'd say it's usually a year at least, but there's a lot we're accomplishing. And since we get parents in and we're really helping to train them in the skills and coaching them up, it's really helpful because it helps them know what to do at home. It helps them to know how to practice all the time and make it part of their, we say, exposure lifestyle. So it becomes something that they're always just thinking about. They go to Target, they go to the grocery store, they go buy ice cream, they're talking to grandma over FaceTime. So they're kind of thinking about different opportunities all the time to practice and how to encourage their kid when they get stuck, how to warm them up when they enter a new situation, kind of what to do and not to do. So it's really empowering the family to be part of the therapy.
I tell parents a lot, if your child is seeing a therapist and you are not seeing that therapist, if you're not part of the treatment, that person has not been trained in what we now know about anxiety.
I mean, I feel like any therapy with kids it's got to be some sort of family therapy component to it because they're with their parents all the time. Like this is not where you can come in for an hour and just work with them and expect things to generalize spontaneously. Like we have to work systemically to bring in the parents, to bring in the school teacher, to help everybody kind of on the same page. Also looking at the kid through the same lens of like, this is an anxiety. This is something we have to work on consistently. And it's, again, not overwhelming them, but it's always this gentle push of we're trying to make consistent progress, but it's individualized based on where they are. So it's not, okay, session 1, this is what we're doing. It's wherever they are, this is where we start. And then we're pushing forward. And sometimes we have to be at one part for a little bit longer to get them comfortable. And then we'll push again. But that's really where the technique, I think, comes in, is being receptive to the kid and knowing that we're not pushing too hard and too fast. Because that's when we see behavior pop up. That's when we see them feeling flooded and overwhelmed. This is gradual. And we're really looking at it in steps to help them be exposed, be comfortable, and have opportunities.
And to be really clear, I say this a lot because I want parents to understand, it's not because it's the parent's fault. That's not why the parent's involved in treatment. It's because the parent is the key to helping the child grow. Anxious brains are going to be anxious. Your child needs these lifetime skills, and you're the one who they will be coming back to again and again. I have a child who's 21, is anxious, and still sometimes I have to say, so what are those tools? What have we been talking about? What's going on for you here?
Like, I love saying it though, right? That's definitely how a therapist speaks, because it's not about telling them the tools. It's about getting them to tell you what they need to do while still being supportive, right? As opposed to dismiss it. You know what to do. You've been through this before, which is not validating. It's saying, okay, what's the tool that we need right now? And have them think about, okay, what should I be doing? What's going to be helpful? If I don't remember, okay, where should I go look for that? So I know that I can do this myself and that you have the confidence that they can.
Yeah. And I have to remind myself, because it is very easy, even now, as an expert in anxiety with an anxious adult child, it is still very easy to go, oh, wait, I'm accommodating the anxiety. I'm not supporting my child in doing the things that they need to do. So which is basically to say to all of you listening, I hear your screams. This is hard work. And anxious brains are going to be anxious. I'm also anxious. And so it's very easy for us to get looped in. But such is life. We always have these opportunities to continue facing it and continue growing. Yep. So you have some resources for kids and also for parents. Can you talk about those resources?
Yes, I co-wrote a children's book called Bravery Grows in 2022. We wrote it in Hong Kong because obviously COVID restrictions were very strict here and all around the world, and we weren't able to have access to as many SN kids as we wanted to here. But also globally, people weren't able to go to therapy because they were worried. And we wanted to create a children's book that really is a beautiful book that you could have in a classroom or a kid would want to pick up in their bedroom, but that kind of explained what it feels like to be a child who is a bit perplexed and frustrated by why they're unable to speak when they really want to, but the words won't come out. And in there, the parents, they have statements that we teach the parents to say and how to, praise them, and also say their brain muscles haven't grown fully just yet. And so there's a lot of little phrases in there for parents as a takeaway. We intentionally made the child kind of ethnically ambiguous. So it can look like a lot of kids so that they can have some identification in there as well, but that it's a very positive story. It was a tiny whisper at first, and then it's a step. So it's just talking about the process and just how great it is to be able to take that step and how much fun it was and just the reinforcement around it. Then after that, we just came out with a journal, and it's a 6-month journal that's really for the kids, but to do with the parent. And so it can be as young as 6 and go all the way up to 11. There are some mantras, there's little reflections in there, there's some goal setting, there's tracking of when they're doing something brave every day so they can look back and also see all the brave things that they're doing and really think about it to celebrate it, because a lot of these kids have trouble praising themselves. Really good at criticizing, not so great at praising. And in there, there's also scripts for parents for how to help their child do an exposure and what that looks like. And there's some little guides in there. And in the back, there's some other tools for caregivers too, because so much of the work really happens at home. And to empower parents, but also do something collaboratively with your child is so helpful for you guys to feel like you're in it together and that you're both working towards something and talking about what feels hard.
I think it's great to get something like that too, to also notice as you're working through it, where is your resistance around it? Because that would be natural. That's part of it. Will help you identify where you can also grow, which helps your child grow because we're a family system. We're also modeling, and it helps create that culture of bravery in the family. Shifts the way we think about things that are difficult. And for parents who are anxious, learning those skills also allows you to see, oh, this is why it's hard for my child because this is hard for me. And I'm an adult. I have fully developed frontal lobes and I still feel resistant. And so it's great modeling. I'll put in the show notes a link where people can check out your resources. And then you have camps that happen here in the States.
So we're going to do our first camp in Southern Maine in Kennebunk for this summer. We're going to do 2. So one in July and one at the end of August right before school starts, because there really aren't many camps in the Northeast, and that's where we can spend our time in the summer. We do 2 camps a year here in Hong Kong. Some families who come from overseas, but a lot of families here, and we purposely do it right before Christmas when all the holidays and family, and then we do it right before school starts also. Our school starts a bit earlier here so that they have all of this practice over 5 days before school starts. So it's, 5 hours a day, like 5 days in a row with, analog class kind of activities. So we kind of make a classroom, we're doing presentations, and then we do a lot of community things too. So we're out having at least 2 days out of the clinic, doing it in different places. Like we have beaches here, so we'll do it at the beach. So they have the sensory, and then they're going to go talk to strangers, and then they're ordering ice cream. So there's lots of fun activities, but woven in there is lots of skills and practice too. So it's all about just exposure, but also having a good time too.
It must be amazing for them to meet other kids with the same challenges. That must feel really empowering.
It feels good to see them playing together with less anxiety, to just be splashing on the water together and making sounds and talking to each other, and just, and what's great about these intensive camps too is they're always one-to-one, so that every child is getting that individual attention. And then again, because we're working on exposure and helping them adapt, we change the counselor every day. So it isn't just I have this attachment to one person, it's that I can generalize my gains to every person that I am working with. And it's so important for the kids to have that, because we want them to generalize their gains to every teacher, every TA, and we want them also to get used to talking to other kids, not just one. We really want them to be able to generalize their ability to advocate and to engage with others to anyone they encounter.
Are there any success stories you can share with us to help inspire parents that their kids can have those successes?
I mean, there's so many. This is one of the most amazing things, because, these kids go from not talking in certain environments to talking. So, when we can get kids here at the school interview process, is kind of crazy. So when we get kids going for school interviews at 4 and they get into school and no one has known that they had SM because they're talking right away, maybe they're a little bit quieter. That's a huge success story. Today, I just got a message from a parent who says, my daughter's speaking more in class now, but actually she was being super silly and really loud, but then the teacher wasn't sure what to do. And I was like, that sounds like a huge win to me. He's like, I will take a complaint that she's being too loud in classroom any day when she wasn't talking at all. And I'm like, so there's lots of success stories about it. It's really just, giving time and having it be fun and rewarding. Even today I had a little 3-year-old come in, And, she also has separation and, right in the waiting room, highs and goodbyes are so hard. And I walk up and I say, hi, and I say her name and I just wait. And then she kind of looks at me and then I was like, you can say hi or hello. And she's like, hi, Dr. Melissa. So right away in the waiting room, which is already huge progress before we even get into the room. But if they've been in for a little bit, we're working on kind of, the greetings. We're working on playing games in the room. We're working on speaking in full sentences. And it's again, like this dance that we're doing of trying to build those gains, but also going back and forth between the kids.
Anxiety is so responsive to intervention.
Yes.
Yes. Okay. What happens if a child with selective mutism is not identified for a long time? What happens to those kids who don't get access to appropriate treatment?
So we know that the longer that you wait to have intervention, the smaller the world will get and the more reinforced their avoidance of engaging in those environments. It can be over time. And what happens then is we start to have maybe symptoms of depression coming up, isolation, possibly substance use when they're even older because they're self-medicating to kind of cope. So again, we want to get them ideally when they're young, but I do have kids who are tweens even, and it's really just working with them where they are. A lot of times it's medication at that age too, just because it clearly has been persistent for many years. So if it's a numbers game at that point, they've gotten really good at not talking in all those environments. And we also then have to think about how we're going to get some motivation for them within themselves. Like it's not just reinforcement, it's actually motivation and we need to see how it's worth it. So sometimes it's independence, like you want to get a license. Like, how can you get a license if you don't answer if a policeman stops you? Or like different things like that, like being able to take the subway or getting on a bus. Are you able to let the bus driver know when you need to get off? That's a big deal. Or if someone is crouching in on you or invading your space, how to say, don't touch me. Like these are all life skills that are really important. And that's the motivations that we have to use is to help them understand that the reason we speak isn't just to always just be talkative. Like that's a great thing to have the social skills. It's also a life skill to be able to advocate and survive and get needs met. And you got to be able to do that. If you're ever in an accident, you need to be able to tell the doctor what hurts. And a lot of these kids in those situations are unable to. So that's kind of where we have to work when they're older is that motivation piece to help them feel it's worth it to feel uncomfortable, to be able to start to talk. The attitude I have towards parenting in general is it's hard for us to let go. It really is. Like I'm really struggling. My oldest is 13 and just the idea of them getting older, like it is hard. But part of them getting older is them needing to go out and explore. And I want them to feel the best that they can about it. And some kids do need longer with cuddles at night or the checking in, but we want them to be able to adapt. And something cool they have here is all kids have to go to overnight camp with the school starting in third grade. And it starts with one night and it goes up to a week. So for example, it was one night in third grade, 2 nights in fourth grade, 3 nights in fifth grade, and now sixth grade, it's a week that they're in Hong Kong somewhere. And then seventh grade, they go to China on a train. And then in eighth grade, they fly to Beijing. And this is not uncommon. At some of the other schools, like British International School, they go in fifth grade, they fly to Beijing. So it's all about having that experience and wanting to be able to go and participate and tolerate the separation. And even the kids who don't have full anxiety disorders, the parents are like, can we have a phone while they're away? And part of this experience is no, there's no phones. It might have one phone call to you on the teacher's phone or something during the day, but it's about being with your peers, learning to separate and knowing that you're okay and you can do hard things. You might not like the food. You might have to camp and sleep in the dirt in a tent there, but you're going to be okay and you can do hard things. And it's a really great thing to see that kids are able to do this. And there's so much fear and trepidation from both the parents and the kids. But being able to overcome this and be uncomfortable, because a lot of these kids aren't outdoorsy necessarily, it's great to be like, I didn't like that at all, but I did it. And like just gives it, I can do anything.
I had pretty severe social anxiety. I still have social anxiety. I would have hated that, but it would not have killed me. Like I would have lost my mind about it and cried and begged my mother. I know that. And I also know that I would have come back and said, well, I did that thing. I would not have been like, that was amazing. I just would have been like, yeah, I did that thing. Because you probably know in the States, it's really common. You do an overnight camp in 6th grade.
Oh, no,
Yeah.
I didn't know that they did. Like in Florida, I grew up in Florida.
I grew up in Ohio, but I've talked to a lot of different people at 6th grade sleepaway camp. I hated it. I was homesick. It was very dramatic for me. I survived it. And then I remember coming back like a soldier coming back from the war, like, oh, I did the thing carrying my sleeping bag. It was bad. It's bad.
Well,
Yeah,
you did it.
But I did it.
Of doing it though. Like I did something that I really maybe never want to do again, but I did it.
And then I realized I can do things that I want the result. I can do the terrible thing for the result. It changed the way I thought about myself. So I get the urge to protect our children, but we need to allow them the idea of themselves as someone who can do things that are kind of terrible, but not actually harmful.
I think that's the biggest difference. And, it's important for our kids to wobble. It's important not to just clear every obstacle out of their way. Like they're going to have to fight for some things. They're going to have to not be good at it at first and then maybe try harder or practice more or sit down and prepare or ask for help. Like that can be hard. And the more that we encourage our kids to do that and feel good about that they can do it and have a need met and reach whatever goal they wanted to, it's only going to make them feel more capable that they'll be able to do that the next time when they face a challenge. They'll feel better about their problem solving and their ability to cope. And that's what we really want our kids to do, is feel like they can handle it. Not that life's going to be easy breezy in any way. There's going to be bumps. You're going to have obstacles and you're not going to get everything right away. But what are you going to do then? How are you going to get around it? How are you going to problem solve and make a plan? And that's what we want our kids to be able to do, is figure it out and believe that they can if they put forth that effort.